Hello and good evening, everyone. My name is Ranz Garcia, and today I'll be critiquing a paper entitled Fluorescence and Cytohybridization to predict the efficacy of Bacillus calmette-guerin perfusion in bladder cancer. So, the contents of this presentation will go as follows: summary of the research, introduction and background, methods, results and discussions, conclusion, and then ended by the references. So, a little bit of information about the article. So, here we have the respective authors that contributed to the article. The keywords used in this article are fluorescence society hybridization, or FISH, to be called from here on out, bladder cancer, which can also be referred to as BCA, Bacillus calmette-guerin perfusion, or BCG perfusion. And this study was also published on October 27, 2022. So maybe start on the summary of the research. We have here four aspects of the summary. We have the purpose of the research and the reagents and samples used, methods and instruments used, and then the major conclusion. So first we have here the purpose of the research. BCG perfusion is a commonly used treatment for moderate or high-risk non-muscular invasive bladder cancer. However, the possibility of the bladder cancer to reoccur is still very highly likely. The study uses fluorescence in situ hybridization to evaluate its prediction of BCA in response to BCG perfusion. So we use fish to check if the bladder cancer will have a chance of reoccurring. So we have here reagents and samples used. We have the Univision kit consisting of chromosome-specific centromeric probe CSP3, which will stain the chromosome green, or part of the chromosome green rather. CSP7, which will stain it red, and gene local-specific probe GLPP16, which will stain it red. CSP17, which will stain green, and the other reagent that we'll be using for this research is the BCG. Methods and instrument use. So the methods will, as stated before, will be fluorescence in hybridization, uh, BCG perfusion, and SPSS2 4.0 for statistical analysis. We now have the major conclusion from this research. A positive FISH test after BCG perfusion predicts the risk of resurgence of BCA, likely to occur within 6 months. So, if the FISH test came in positive after one has undertaken BCG perfusion for their bladder cancer, if the test turns out positive, there is a very high chance that the bladder cancer will recur or resurface. So, we now move on to the introduction and background. So here we have the introduction. Cases and mortality rate of bladder cancer have been on the rise in China. Transurethral resection of bladder tumor, or TURBT, combined with the use of Bacillus calmette-guerin perfusions, are used to treat moderate or high bladder cancer. Despite its effectiveness, however, BCA still has a high chance of recurrence. So the gold standard for post-op after the use of TURBT and BCG is cytoscopy and urine cytology to be able to check whether the bladder cancer resurface or to follow it up. However, the problem with this is that it cannot predict if the BCG treatment is effective. There is no fit or the cystoscopy and urine cytology will not be able to determine if the bladder cancer is fully eliminated, and there is absolutely no chance of it recurring in the future. So the purpose of the study is to evaluate the predictive role of fluorescence in cytohybridization for the effectiveness of BCG perfusions in bladder cancer. So here we now have the methods. There are two methods that were used in the study. First, we have FISH, or fluorescent in cytohybridization. This one is used for locating the specific DNA sequence, diagnosis of genetic diseases, gene mapping, and identification of novel oncogenes or genetic aberrations contributing to various types of cancers. So we use FISH to be able to determine if there is a likelihood of cancer still progressing or reoccurring in the future. And here we have Bacillus calmette-guerin perfusion, or BCG, as we mentioned before. It is a treatment for patients with bladder cancer. BCG is introduced via catheter. So the BCG solution will be inserted into the bladder using a catheter, and this will help in treating the cancer of the patient. So results and discussion. So here we have a table which was taken from the study. Uh, the table is aptly entitled univariate analysis of recurrence and progression of bladder cancer after BCG perfusion. So here, if we look at the second row of fish positive after BCG perfusion and look at the p-values here, we'll be able to determine that there is indeed a significant correlation between the recurrence of bladder cancer and a positive fish test after BCG perfusion. Many studies in a similar field also state that there is a significant correlation between the recurrence of BCA and a positive fish test. However, there are also findings from different authors which states that there is no strong correlation between the recurrence of BCA and a positive fish test. The reason for this inconsistency has to do with a different patient cohort. The patient cohort may differ in demographic, procedures taken, and difference in researcher data collection. So there might be a difference in how the researchers conducted their study, or there is a difference between how they they collected their data, or maybe there's some other factors such as the demographic of the patients themselves. And this study will be using in this study they've used their demographic is mostly of Chinese descent. So now we move on finally to the conclusion. So to conclude, a positive fish test taken after BGC or after BCG perfusion rather predicts the likely recurrence of BCA. It is said that patients with who test positive for fish after undergoing BCG perfusion in response to BCA should closely follow up regarding their bladder cancers. The researchers of this study recommend future researchers to formulate a treatment plan for fish positive patients after BCG perfusion. So, the main takeaway of the study is that fish is indeed a very effective way to determine if there is if bladder cancer will still reoccur for the patients after taking BCG perfusion. So here are the references used to be able to understand this study better. And that concludes the presentation for this critic paper. So thank you very much for listening, and that will be all.